Imagine you're deep in the wilderness. 50,000 years ago, you trip. A jagged root tears a deep gash into your leg. In our world, this is a quick trip to the ER and some stitches. But here, it feels like a death sentence. There are no pharmacies, no antibiotics, no sterile gauze, just you, the dirt, and the billions of bacteria already beginning to crawl into your bloodstream. How did our ancestors not just die out from the simplest infection? To understand how we survived, we have to look at the hidden beginning of human science. You are a member of a small hunter-gatherer tribe. Your body is your most valuable tool, but it's fragile. When you get a fever, you don't have a thermometer. Instead, you have inherited knowledge passed down through thousands of generations. You look at the forest around you not just as a pantry, but as a pharmacy. The real reason humans survived is that we have been self-medicating since before we were even human. Just like you see animals today eating specific grasses to settle their stomachs, your ancestors observed which plants healed and which ones poisoned. This wasn't just guessing, it was the first iteration of trial and error science. Here is where it gets weird. Scientists recently analyzed the dental plaque of Neanderthals and found something incredible: traces of poplar bark. Poplar contains salicylic acid, the active ingredient in modern aspirin. 50,000 years ago, your ancestors were chewing on trees to stop a headache. They even found traces of penicillium mold. Long before Alexander Fleming discovered penicillin in a sterile lab in 1928, early humans were likely eating moldy plants or using specific fungi to treat infections. They were using the chemistry of the earth to fight back against the microscopic world. But medicine isn't just about plants, it's about behavior. This is the real reason we are the only human species left. In a 1970s excavation, archaeologists found a skeleton known as Shanidar 1. This Neanderthal had survived a massive blow to the head, a crushed eye socket, and even an amputated arm. He didn't die when those injuries happened. He lived for years afterward. Why? Because his tribe didn't leave him behind. They brought him water. They kept the predators away. They shared their food. Unlike almost any other animal on Earth, humans developed a social safety net. Empathy was our most effective medicine. And when the situation got truly desperate, we didn't just pray, we performed surgery. Thousands of years before the first hospital, humans practiced trepanation, drilling a hole into the skull to relieve pressure. And the bone growth on these ancient skulls shows that the patients often survived the procedure and lived for years. So, how did we survive without modern medicine? We did it by turning our environment into a laboratory and our social groups into a hospital. We weren't just waiting to die. We were the first doctors, chemists, and nurses. Modern medicine isn't a replacement for ancient survival, it's the evolution of it. You are here today because 50,000 years ago, someone in your tribe knew exactly which leaf would stop the bleeding. If you want to know more about the real reasons behind our history, check out our video on why humans started wearing clothes. Stay curious.